So now we're going to look at fractures and how bone repairs itself, and what, as healthcare providers and with physicians, and how they repair a variety of things. So a fracture will heal whether or not it is reset by a physician. So there are closed reductions of fractures, which you can see here on the photo on the right. And oftentimes these actually appear, when you're watching, appear to be very violent. But because of the way the bones and muscles try to protect themselves, oftentimes with fractures and dislocations, muscles will spasm, which takes a lot of force to actually manipulate those areas after that. So you might have, depending on the type of fracture where it's at, you might have a closed reduction. You also might have to have an open reduction, which is a surgical procedure where either plates or screws or rods are placed into bones to reduce those fractures. So we're going to look at different types of fractures. First, two general broad categories are closed and open. Closed fractures are fractures that do not pierce the exterior of the skin. So as you can see, this is a color 3D X-ray. And so this is a displaced fracture, so this will need to be reduced. However, you can see that it is not piercing the skin. The closest point that it has is down here, but you can still see the skin tissue a little bit below that. So this is a closed fracture. And then you have open fractures, which is where the bone will actually exit the skin. So two general broad categories of fractures. So now we're going to look at a variety of types of specific fractures, and these are in your book. There's a diagram in your book, but I chose to find x-rays to kind of show you more exactly, more from a diagram. So the first one on the left is a transverse fracture. So the word transverse means going across something. So you'll hear that quite a bit in anatomy and physiology. For example, you have the transverse colon, which goes across the abdomen. So with this example, you have a transverse fracture, which simply goes across the bone. On the right, you have a spiral fracture, and you can see how this fracture, it looks like there may be at least maybe three different pieces. So there's one piece, there's another piece. This is obviously the ankle. So this is going to be the tibia, and here's the probably this third piece. So you can see that this is a spiral fracture. So you're only seeing two dimensions of this. If you saw this in three-dimensional, in a three-dimensional X-ray, you would see that this is actually going around the bone. And one thing to keep in mind is that obviously you're not going to see, in the field, you're not going to see these x-rays, at least from the scene. You may see them in the ER, but you also may see them written in charts of patients that may be transferred from one place to another. And so this will give you an idea of what they actually look like. So the next one is a comminuted fracture. This is caused by forces that are applied to one end or the other of the bone. For example, this is obviously a leg. So if someone, for example, fell from a distance and landed on their feet, this might be what you would, one of the things you might see. So as you can see, there's two different views here. You see a variety of fractures. You see a variety of bone fragments through here. And so this is going to be a very serious type of fracture, very painful and very difficult to actually fix. The impacted fracture is similar in cause. It's forces applied to one or the other ends of the bone, but instead of splintering and fracturing like the comminuted fracture, the impacted fracture actually just sort of shoves bones together. So this appears maybe this left center diagram here appears to be possibly the humerus. So maybe where someone fell and put their arm out and they have this impacted fracture. So you can sort of, if you look real close, you can see these, anything on x-rays that is, the wider that it is, the more dense, or the more dense that it is. So you see these lines through here, these are not normal. And so this is bone that has been impacted, and you see that the fracture line is marked here as well. So you see that this bone has just been shoved into the head of the humerus there. This is a little bit more difficult to see on the right side here, the right side picture, the impacted fracture. But the fracture line shows it's probably really close to the epiphyseal line here. And again, this is, the arrows are showing forces, so this is appears to be maybe the possibly the foot. It's hard to tell with this, but where forces have been applied to both sides, and you see these striated lines through here, which are not normal. So that's an impacted fracture. A green stick fracture is a twisting type fracture. Oftentimes you see these in children when their bones have not fully hardened yet. And if you think, the easiest way to remember a green stick fracture is if you pull a twig from a tree and that is very green, and you know it's very typically small, and you twist it, you will see this green stick type fracture. And this is exactly where this gets its name from. It doesn't completely break, it just sort of splinters apart. And so usually with twisting forces, and you can see the arrows here showing forces in both directions. So oftentimes these are twisting type forces. And again, typically, not always, but typically in young children whose bones have not hardened yet. On the right side, you see an oblique fracture. And oblique simply means going somewhat diagonal in a bone. And you see how this particular x-ray shows how it was treated and then the end result. So the left picture here, you see the fracture before it was fixed. You see in the center, you see the two screws there holding the bones together. And then the right picture, you see as the bone has healed, you still see the paths through here where the screws went. And you can see the really dense bone where that is still in a healing process there. So there's a variety of stages of repair that a bone goes through. The first is a hematoma form, so it's called a fracture hematoma, and it's like any other hematoma that you would read about or learn about. It's a collection of blood. So as you were taught as an EMT, in especially large bones like the femur, maybe the humerus, you can have quite a bit of blood loss. And this is part of this is from the hematoma. Others might be from arteries and veins that are actually cut by the bone ends. But you see this hematoma forms. As time goes by, the bone forms an internal and external calculi, or calculus, which is a protective healing mechanism. The blood from that hematoma will be reabsorbed into the tissue and into the bone. And then you start to form the bony structure. You can see in the third picture the bony calculus of the spongy bone. And this is cartilage that's being replaced by bone. And then you see the healed fracture, and the photo on the far right, you see the healed fracture, what it looks like on the inside. And notice that this bone before it was fractured was probably straight up and down. And notice that it's no longer straight. So as these bones heal, they are not going to heal usually perfect like they were initially formed. So you can see this still has a little bulge here, and that will probably remain throughout that individual's life. So this is an X-ray showing how the bone repairs itself. So this looks like an oblique fracture here on the left side. On the right side shows the healed bone. Again, you see this really dense bone. You see the calculi formed on the side here. And again, that may become a little smoother, but it may not. So it just depends on that individual and how that healing process progresses. So exercise is very important for healthy bones. Like any other tissue, bones will atrophy or waste away when they're not in use, which is why we see people in nursing homes, for example, that do not get up and move around much. Their muscles and their bones tend to atrophy. So regular exercise creates greater bone density. Resistance training is the most important for strong bones. So resistance training is, as this picture is showing, an example of that would be these large rubber bands that you may see used by physical therapists or occupational therapists. And it's simply where you would hold the band up with both hands and push down with your feet. So that would be one example of resistance exercising for the lower extremity. So nutrition is also very important for having healthy bone tissue. Calcium is vital to bone health. The body does not make its own calcium. The only calcium that the body has is what it takes in through either dietary or supplemental forms. Calcium cannot be absorbed from the small intestines without vitamin D as well. And vitamin D, sorry about that, vitamin D is formed from being in sunlight. So again, being in sunlight to produce vitamin D to help to assist with absorbing that calcium is very important. Sources of calcium include milk and dairy products, green leafy vegetables, broccoli, intact salmon and sardines, also nuts, beans, seeds, and shellfish. So it is important to remember that calcium is not made within our body, only what we take in through foods or dietary supplements is what we have. So also vitamin D is not found in many foods. The body can produce it with exposure to sunlight. So this diagram is also in your book. It shows you what goes into from sunlight to producing vitamin D. Vitamin D is ingested through food and supplements and absorbed by the intestines and then carried to the liver through the blood. Vitamin D is manufactured in the skin after absorption in the sunlight. So two places where vitamin D or its different forms of it are saved and stored by the body are in the liver. So once in the liver, vitamin D turns into calcidiol, which is the primary form of circulating vitamin D in the blood. In the kidneys, vitamin D is transformed into calcitriol, which is a biologically active form of vitamin D. So again, if you remember that vitamin D is stored in its different forms in the liver and the kidney, you need sunlight to produce that. And then you need vitamin D for calcium to be absorbed from the GI system. Other nutrients, vitamin K supports bone mineralization, comes from green leafy vegetables. Magnesium, over 60% of our body's magnesium is found in the skeleton, plays a role in the structure of the bone. Fluoride helps stabilize and strengthen bone minerals. Omega-3 fatty acids reduces inflammation, which can interfere with osteoblasts. So omega-3 fatty acids, which a lot of it comes from fish, reduces inflammation, and that inflammation can interfere with bone function and bone regeneration. Hormones in bone tissue, the pituitary gland secretes growth hormone. You'll often see growth hormone abbreviated as GH. So when we get into talking about the endocrine system, you'll see a lot of hormones with abbreviations. And these are standard medical abbreviations that you'll need to pick up on. So growth hormone is GH, and growth hormone, as you might suspect, controls bone growth. The thyroid gland secretes thyroxine. Thyroxine promotes osteoblastic activity and synthesis of the bone matrix. So again, the endocrine system is all interwoven in all of our body systems. Estrogen in girls and testosterone in boys is responsible for the growth spurt during adolescence. Decreased levels of these hormones can trigger end of growth and epiphyseal plate converting to the epiphyseal line. So someone who has hormone imbalance or is taking some sort of supplements that interfere with this can affect the beginning and the end of bone growth. One common disease you'll see with bones is osteoporosis. Osteoporosis is a decrease in bone mass. It's common as the body ages. It occurs more rapidly in women, especially after menopause. It's most commonly seen in the proximal femur, the vertebrae, and the wrists. So if you look at this diagram, you will see that around between age 50 and 60, which is where many women hit menopause, you can see that bone density significantly decreases. Where men, it's a slower curve. It's a not quite as steep of a curve. So this bone loss occurs more rapidly in women, especially after menopause. And this is why we see, with most commonly seen in the proximal femur, we have elderly people, especially women, with hip fractures. Oftentimes, we really never know sometimes from the field what happens when we see somebody with a hip fracture. We think maybe they fell and then fractured their hip. More often than not, likely they have been just walking through their house or their apartment, and because of osteoporosis, the head of the femur fractures, or the head of the femur fractures, at the neck rather, and then they fall. So this is also why we see with the vertebrae, we see the kyphosis in elderly people, especially women. As the vertebrae begin losing bone mass, the weight that it supports with our body, bones begin to break. They begin to fracture. They also begin to lose their mass or their height, which is the reason that elderly people tend to lose height as they age. And then also in the wrists, we see this happening as well. And so we see wrist fractures as, especially in elderly people, falls increase for a variety of reasons. And as we tend to do when we fall, we reach out to catch ourselves, and these folks will often have wrist fractures because of that. So again, still looking at osteoporosis. Hip fractures can be a life-threatening injury due to the immobility. If the hip fracture itself doesn't cause any major problems as far as loss of life, the healing process, the recuperation, the rehabilitation may cause life-threatening problems. So you see in the top picture diagram, you see healthy bone and the bone matrix, and then you see on the right side the osteoporosis and how the bone has thinned and the matrix is partially broken apart, which makes it a lot weaker to stresses. So some of the things that you see with hip fractures during the immobility of the rehab are blood clots. So these can be in the legs, but can also be in the lungs as a pulmonary embolus. Due to the immobility and the lessening of the respiratory function, they are susceptible to pneumonia. Because of the immobility, laying in one place all the time, they are also susceptible to pressure sores. This is why in hospitals and nursing homes, they are trying to get people up a lot more than they used to. They're trying to, if they're not able to get them up, they're rolling them in bed frequently, not letting them lay constantly because you end up getting, especially if you lay on your back, you end up getting pressure sores on your heels, on your buttocks, elbows, the back of the shoulders where the scapula are at. So you have any place where there's pressure, you need to move periodically. And then also they're susceptible to urinary tract infections. This is oftentimes because they may have a urinary catheter or just their immobility. They're not able to get up and they go in their bed or they go in their Depends or their diaper or whatever. And over time, this can cause urinary tract infections. Calcium is the most abundant mineral in the human body, as well as the bones. So that's something to keep in mind. Calcium is not produced in the body. Calcium ions are needed for bone mineralization, teeth health, regulation of heart rate and strength of contraction, blood coagulation, contraction of smooth and skeletal muscle cells, and regulation of nerve impulse conduction. So as you can see, calcium is very important, but it's not produced in the body. So it's only, again, just like some other minerals, they're only you only get what you actually take in through your dietary intake. Hypocalcemia is a term describing low blood calcium. So again, looking at the medical terminology of this, you have hypo, which means low, the cal, C-A-L-C, indicating calcium, emia indicating blood, so you have low blood calcium. The parathyroid gland has calcium receptors. When there's not enough calcium, the parathyroid releases parathyroid hormone, again, a hormone that a common abbreviation for this is PTH, so it's parathyroid hormone. Parathyroid hormone demineralizes bone for the calcium and promotes reabsorption of calcium in the kidneys. So when the body doesn't have enough calcium, the parathyroid releases parathyroid hormone, which then does two things. It pulls calcium out of the bone, so that also, if somebody's not getting a regular intake of calcium, that also assists with osteoporosis. But the parathyroid hormone pulls bone or calcium out of the bone and also promotes reabsorption of calcium in the kidneys. So if you have any kind of kidney dysfunction, that may inhibit that process as well. And also parathyroid hormone stimulates synthesis of vitamin D. Hypercalcemia is the opposite. It's high blood calcium. The thyroid gland releases calcitonin, which causes bones to absorb calcium. Calcitonin also decreases reabsorption of calcium by the kidneys. So if you have low blood calcium, the kidneys will be stimulated to reabsorb that calcium to put it back in the body. If you have high blood calcium, the kidneys will be stimulated to decrease that reabsorption or let it pass through into the urine to be excreted from the body. So the two things, again, that do this with hypocalcemia, parathyroid hormone is the key substance that attempts to treat this problem. And with hypercalcemia, calcitonin is the key substance there. So this diagram is in your book, and this just puts into picture form what I was just explaining to you. So if you're a visual learner, this may make more sense to you. So the top part of this is what happens with increased calcium levels or hypercalcemia. The bottom part is what happens during hypocalcemia or decreased calcium levels. So you will see calcium ions written as you see here with Ca2+. Again, going back to the first unit with why those might be, why those are ions and not just elemental substances. So again, this puts into diagram format what I just described on the last slide. So that concludes the chapter. So if you have any questions, feel free to get with me.